Bill Clinton exclusive on the nightmare that keeps 45 million Americans from seeing a doctor. The healthcare disaster.
It's difficult to see how America can be a preeminent country in the 21st century without an affordable, high-quality healthcare system.
He couldn't change the system. Can President Obama?
I think he's doing it right.
If you can't afford to get sick, if you're going broke getting treatment, if you're desperate to help your suffering child, you need to watch this show. Plus,
Christopher did not get that chance, but maybe one day others like Christopher Reeves might.
Christopher Reeves' daughter on President Obama's stem cell policy reversal. It was too late for her father. Is it in time to save your life? Next on Larry King Live. I'm Dr. Sanjay Gupta, sitting in for Larry King. The healthcare system itself is an ailing patient, and it needs to be healed. That is the message from President Obama, and he kicked off the effort last week with the White House summit. But talking healthcare reform is one thing, achieving it quite another. Just ask Bill Clinton. In the fall of 1993, polls showed 90% of the public wanted either a fundamental change in the healthcare system or a complete rebuild. So I sat down for an exclusive interview with the former president to talk about this earlier today. Now, in the interest of full disclosure, I was a White House fellow during his administration and served as an advisor to then First Lady Hillary Clinton. Plus, until withdrawing my name, I was under consideration to become this administration's Surgeon General. I began my interview with Bill Clinton by asking why, despite the public's appetite for change, he couldn't get health care reform done.
Well, I think first we had a couple of problems that don't exist today. At the time, let's review the bidding. At the time, we had about 14 or 15% uninsured. Today, it's more than 16%. We had a lot of people underinsured, but there are probably more than 30 million underinsured today. Huge underinsured problem. We were spending 14% of our income on health care. Nobody else, none of our major competitors were more than 10. Now we're at 16.5, and none of our competitors are over 11, except for Switzerland, which has an unusually old population. They're at 12. So all the problems are worse. Secondly, they really, both in the presidential campaign, good ideas came out, and both Senator Obama and Hillary came out with this idea that you could achieve universal or near universal coverage without an employer mandate if you subsidized individuals and small businesses and gave them the option of buying into the federal employee health insurance plan, which is a bunch of private plans, as you know, assuming there was no other available option. So when I did it, we had budgetary constrictions. We couldn't raise taxes. We just raised taxes and cut spending to balance the budget. And therefore, our only option was to have an employer mandate. That put the small business lobby in with the health insurance companies, and together that plus the unified Republican opposition in the Senate was enough to beat it. Now, you've got the small business community wanting something to do. The physicians were divided last time. They're united in believing we need reform. And a number of the health insurance companies have said they are willing to move toward universal coverage. So I think that the consensus is overwhelming. You don't have the problems in the Senate that you had last time, although there's still a theoretical possibility of a filibuster. So I think the politics and the economics are much better now, and the policies are better. The policies that came out of the Democratic primary process this time are, I think, refined. They've made advances over where we were. So I feel good about all that. I still think the big test now is going to be, how do we do more to bring cost in line with our competitors and improve health care? We got to do more primary prevention. That's why I spend so much time on the obesity issue, because I think that if we don't change the delivery system, then we'll cover everybody for a while, but we'll be up to 18 or 19% of our income on health care, and eventually we won't be able to afford it.
I want to talk about some of those cost-saving measures and what you've been doing since you were president as well. Let's talk about the timing of this. You talked about the politics, the cost. The economy is in the tank, by all measures. It's the economy stupid. That was the mantra of '93. Should we be focusing on the economy for now? Healthcare is important, education is important, energy is important, but how does that help the economy? How do you sell that?
Well, first, I believe that healthcare and education and energy are all economic issues. It's difficult to see how America can be a preeminent country in the 21st century without an affordable, high-quality healthcare system, without doing a better job in K through 12 education and doing a better job of getting more people into college and out of college, and without becoming more energy independent through clean energy and greater efficiency. And if we do the right things, then education will give us more of the right kind of jobs, energy will generate millions of jobs, and healthcare will both make us a healthier, stronger, more productive country and free up money that we would otherwise be wasting on healthcare to invest in our children's future. So I think they should do all these things. What they have to remember, though, is that there are, in essence, no budget constraints now on Washington because we're in a period of asset deflation. In other words, we're worrying about the economy contracting. So we need the government to spend money now. When the economy comes back, I think in some place between 1 and 2 years is what I think will happen, then the government will have to exercise more fiscal discipline. They'll have to take money out of the system, the Federal Reserve will. The federal government will have to exercise more budgetary restraint. And so it's important if we're going to do health care reform and education reform and energy reform now, which I think the president is right to pursue, that particularly on health and education, we have to know what we're going to do as we come out of this to avoid high interest rates and inflation. But they have no choice but to do this investment now. They're doing the right thing.
Is it the public, are they going to understand that some of the rewards from some of the programs you're talking about aren't going to be felt for a decade, maybe 2 decades?
Well, I think people are pretty smart about that. I think that first, insofar as we expand coverage and protect people in down economic times, they will receive rewards that are immediate. I noticed in the election season, I always thought healthcare was an underreported issue because people talked about the economy, but for many people, many working families in America before the financial crisis, the economic problem they had was healthcare. Healthcare was driving a majority of the bankruptcies in this country. It was keeping parents up late at night. It was the economic problem. And so I think that this is one of those moments when the president can make the case he made yesterday on education and the case he made a couple of days ago on health care. We may not get everything we want right now, but I think it's important to realize that the system will accommodate more change now than it normally would, and he ought to drive through it as much as he can. And if we get the framework in place, then next year and the year after that and the year after that, we can build on it.
50 days now into his presidency, he's had this healthcare summit, as we know about. If he were here right now, what's the one stumbling block that you might remind him of when it comes to health reform?
Well, I think he still has to worry a little bit about a filibuster, but I think he's doing it right. The plan they have that emerged from the primary process, it started all, I don't know if you remember this, there was a big healthcare forum sponsored by the Center for the American Progress in Las Vegas. And Hillary spoke there, all the other candidates did, then Senator Obama did. I thought she did very well there, but she had a bigger knowledge base. You know, she had years and years of working on it. But John Edwards had a very good healthcare plan. So they all sort of upped their healthcare performance after that Las Vegas initiative because they realized what a very big deal it was to the American people. By the time the primary was winnowed down to 2 candidates, there was some difference on how universal the coverage would be. But Hillary's plan and then Senator Obama's plan looked pretty close. The president then made it absolutely clear that he was going to pursue this. And I will say again, we have a simpler, clearer path to the future than we did when I was there. You don't have to have an employer mandate. You don't have to have a tax increase now. And the risk of a filibuster is less. So I think the obstacles are less than they were. Plus, the doctors want it now. The small business community needs it now. And the insurance community even is not unified against it now. So I think we got a real shot here. My worry is more on the back end. I don't want us to wind up getting universal coverage, which is morally imperative and necessary, and not do enough preventive and primary and cost control changes about the way the system is organized to bring our costs in line with our competitors. Because if we're 5 points of our GDP more on healthcare than any of our competitors, and we're getting no better results, now we get worse results, but if we get no better results, then it will weaken our economy over the long run, and we won't be able to afford the system. So his challenge is going to be not the coverage challenge, which is what all of us from Theodore Roosevelt through Bill Clinton face. It's going to be the cost challenge.
Right. You brought up a lot of good points, including one about the role of the former First Lady at that time, a pivotal role in healthcare. We're going to ask you about that when we return with Larry King just after this break.
We have a common task and a common challenge.
Why can't we see that we are all in this together?